Hi, welcome to today's presentation, Ambulatory EMR Project Management Implementation. This is Nabil Rob, your host. Just a little bit of background on myself. I completed my MBA from New York University in 2011 and my undergrad from Johns Hopkins University in 2005. I've been in the healthcare technology space for a majority of my career in various capacities, from being a researcher to advising clients on EMR, electronic medical record implementation, vendors, to implementing systems such as Epic and Eclipsys at various client sites as a consultant and as a full-time employee. And I've also managed ambulatory rollouts from initiation to planning to actually execution to doing the quality control to handing it off to the operational teams. Moving on, today's agenda, we'll be starting off with just about who this presentation will be useful to, and then we'll go on to a GoLive Roadmap. We'll discuss common challenges, leading practices, and then we'll call it a day. So who should be listening to this presentation? This will be useful for physicians, clinical management leaders, practice management leaders, analysts, individuals who are looking for an overview or some sort of framework of implementing a electronic medical record system within a ambulatory setting, specifically small physician practices. The purpose of this presentation is to provide a framework and give an introduction to the different parts of rolling out a practice management and electronic medical record system in a practice. What kind of things to watch out for, what kind of things to plan for, and show you a framework of how to structure your planning and actually structure how you will be going through that process of change management. I'm going to start off with the GoLive Roadmap, and this is a plan that illustrates what you can expect throughout the implementation of your electronic medical record system. Assumptions here is that your vendor has done the project planning of the cycle, and your vendor will be helping you through the process. As a physician or as a practice manager, some things that you should be watching out for is, are these high-level milestones being met? So for instance, the first part we have is the kickoff and gap analysis. You should have a kickoff meeting with your vendor and your staff to talk about what they should be expecting over the 12-week or 16-week, whatever duration this project will be, of switching or going from a paper to an electronic medical system versus going through a legacy electronic medical record system to a new electronic medical record system or practice management system, depending on the scope of the project. During this first phase, we'll define the scope of the project. You will expect some sort of shadowing of your physicians, your practice management, your front desk staff, your billing staff, to get our understanding of the requirements that the practice needs to be successful, and to also draft some workflows for the various different kinds of workflows. For instance, a new patient, if you have a procedure type visit, whatever the case might be, whatever is specific to your practice, so that the vendor who's implementing that system or the practice manager is aware of what you will be doing and is prepared to help you through that process. And during this first phase, it's important to also do a hardware assessment and order the hardware so that you are ready to be engaged, and that this becomes less of an issue as the project progresses. In addition, one thing I didn't mention here is it's important that whoever is doing this kind of gap analysis work or looking at the shadowing should validate their findings with the clinical team, the practice management team, depending on the area of focus. And another assumption here is that whoever is implementing or helping you through this implementation has a structured plan of how they will do a certain level of customization or a heavier amount of customization for the practice. So if there are going to be some future workflows that are been identified, you should be aware of what these workflows are and validate that there aren't any gaps in their understanding of what your practice is doing in terms of collecting blood, for instance, in terms of collecting results, in terms of the process of who gets abnormal results or who gets normal results. These are types of questions that happen during this discovery phase of the implementation. Moving on to the next phase, we call it the build and testing phases, where your vendor or your software solutions team, technology partner, is customizing the solution to a certain degree to fit your practice needs. Let that be through updating some of their registration visit types, or it could be making preference lists for your provider so that it's easier for them to place orders. Whatever the case might be, and these are based on the design from the kickoff and gap analysis phase. After your technology partners, have finished their build, they should have some sort of unit testing and integrating testing between different systems if there are disparate systems between the practice management, the clinical EMR system, electronic medical record system, and the billing system. At this phase, it's important to finalize an abstraction strategy, and by abstraction strategy, we're referring to how the practice will transition the information from the legacy systems or paper charts into the new electronic medical system / practice management system. It's important to finalize this strategy because from the next phase you will begin actually abstracting and transferring that data so that the providers and the practice management staff aren't starting from zero from when they actually go live with the system. In our next phase, we'll be talking about training and abstracting. In this phase, your providers and your clinical support staff and your practice management staff will be trained on how to use this new system and how their workflows will be updated. They've already through their gap analysis and have validated that the understanding has been clear and validated. Now it's time to actually train within the system so that it could be, depending on your vendor, it could be webinars, could be in-person training sessions, could be class settings, could be one-on-one. Whatever the training requirements are, it's important that you have a process where your providers and your staff are trained adequately. Also in this phase, it's a good idea to begin abstracting and start transitioning that information. Could be basic past medical history, insurance information, demographic information into the new electronic medical record system, which should be already in place, and from the last phase, your new hardware should already be in place, and software, if it's going to be a software per desktop, should have been already installed. If it's a cloud model, you should have access to your system by this point. In our next phase, which is the GoLive prep, we want to have actual dress rehearsals, a technical dress rehearsal where your system sees that it's adequately printing. For instance, you have results coming in from ancillary systems. You have other types of, there are interfaces that they are set up and tested very well. And also you want to have a workflow dress rehearsal where all the providers, all the clinical management team members are actually using the system in preparation for the go live date and moving forward. This is a great opportunity to try to identify any types of risks that might have been missed throughout the various phases, through the gap analysis, through the testing, and also a good chance to actually practice it in a relatively test test setting rather than a live environment, which will be shortly coming up with their GoLive. In addition, you want to ensure that the patient volume has decreased for the initial GoLive date and maybe for the subsequent days, so that your staff and your providers have a little bit of wiggle room in terms of how they see the patient, because they know it'll take them a little bit of extra time initially, and as they get more and more comfortable, this disruption will decrease and hopefully lead to more efficiencies. Which leads us to the last phase of this roadmap, where you have the GoLive and operational handoff. During this phase, you've ensured that you have good on-site support. I think I believe that's very much recommended, to have on-site support for the actual first couple of days, if not a little bit longer. And you want to establish frequent communication with providers during that initial GoLive. Let that be through conference calls, through meetings, to make sure that those first initial frustrations that the providers and the clinical staff and the practice management staff are feeling, that they are being adequately supported. And at the very least, as the GoLive support is winding down, you want to have a post-optimization plan or post-optimization support plan in place for the staff and for the newly enrollees of the system, so that they feel supported and they feel that they can reach out to their vendors and their project management team when they are troubled or when they're struggling with the system. We're going to move on to the next slide. Wanted to highlight some common challenges. I think number one challenge with implementing an EMR practice management system is making sure you have organizational buy-in at the physician level. You'll have user adoption issues if all the providers or all the practice management staff are not on board, or not attending training seminars, or not preparing as much for the actual GoLive of the new system. One of the ways to mitigate this is to have a clinical champion, have a practice management champion, a super user of sorts, who will be able to provide support and be a thread of confidence for the team. It's important to define this change management strategy all throughout the project, and especially as you go live and start using the system, your staff should know about what are the escalation policies and how to deal with issues that will definitely come up. Another challenge is a lack of adequate project planning or staffing. There's going to be an increased demand of need for your staff to do activities that they have not been doing. So for instance, if they're abstracting, transitioning that information from the legacy systems or legacy paper charts to a new system, this will require additional staff, or will require additional hours. The question becomes, as a practice management team and as a leader of a practice, is how do you deal with this? Do you increase the number of hours for your staff, or do you hire new staff? That's something that needs to be decided and something that should be planned. And an assumption we've been talking about is that you have your vendor who is tracking some sort of project plan, who's looking at these high-level milestones, and who's paying close attention to, are these milestones being met, or are they at risk, whatever the case might be. It's important that you have a project manager or someone who's in charge of making sure this implementation works according to your expectations and goals. I also seen issues with hardware deployment and decision, and here we're talking about what types of networking needs do you have, what types of computers do you need to get. Providers, we're all strapped for resources. I think it's important to rely on your team, on your hardware team, or whoever your technical advisors, on whatever the best hardware decision, whatever hardware you need to get to be successful with this software, or if it's a cloud-based software, whatever the case might be. Make that decision quickly and move forward so that this does not become a hindrance or some sort of a challenge as you go through the project, through the implementation of this electronic medical record system. We touched on this earlier, workflow issues. This is more where there isn't great communication between whoever is actually building out or customizing your technical solution with whoever has the operational understanding of what's happening in your practice. It's important to develop clear workflows, understand, do that current state analysis, and make sure that everyone is on the same page. Maybe a couple extra meetings to go through Visios, go through workflows, verbalize what you believe is going to be happening, and then actually make sure your leadership is in line with what the expectations are with your technical team. We also touched on this earlier in terms of abstraction, paper chart strategy. Make sure you've determined what information needs to be abstracted from the legacy systems. If it's not going to be some sort of data migration, if it's going to be manual, make sure you have an adequate staffing in place to make sure that happens, and that you're not trying to go live without doing this abstraction. If you're trying to go live without bringing in pertinent information and you're going to treat each patient as a completely new patient to your practice, this will make your life a lot more challenging when you go live, rather than having some of that demographic information, having some of that past medical history already entered, and you kind of working off, leveraging the information you have on your patients as they continuously come. And this process will continue for many months even after you go live. But after you start seeing patients, that this abstraction time dedicated to that will be decreasing as patients will already be entered, and you'll only be doing this type of work for completely new patients who come in for the first time. Training can't be emphasized enough. I think it's important that your providers treat training seminars seriously, and they pay attention to whatever tools that might be in place. Interfaces, this is more referring to understanding which types of results will come back to your system, which types of systems are already tied to your vendor, your technical vendor. If there needs to be licenses that you need to sign, make sure that these are all signed and you've actually done this kind of testing to make sure that you have results that are coming in from lab systems, from pharmacy. If you e-prescribe, make sure you can e-prescribe without a problem. And some of this depends on the scope of your technical solution. Moving on to leading practices, I think it's important to have a physician practice management champion, super user, who can be some sort of a guiding light to your practice. You need that person who's going to be there after the technical team leaves, after your vendor leaves, who's not going to be there day in, day out. And this person should understand the workflows from beginning, from registration to clinical documentation to charge entry to closing the charge to claim submission. Doesn't necessarily have to be one person who knows it all, but you should have a super user who intimately understands the process from the old workflow and what's going to be the new workflow, so that they can guide the other practice members. We touched on this before. Make sure your workflows and designs are validated with the practice leadership. This is just good practice management. It's good communication. It's a good practice to have a successful implementation. Dress rehearsals are important. As mentioned earlier, it helps to mitigate other issues that would have just come up at a go live, and it's a more of a last check gap measure to make sure that your providers and your clinical staff are ready to go, and they can practice on the system in a very real scenario without using real patient data. Abstraction, we touched on this. It's important to have that strategy in place, and it's important that you actually either increase your staff or allocate more hours to your staff, decrease some activities, so that your system is ready and it has enough information to help your providers and your practice management staff go through them in a more faster, more efficient manner, rather than treating it as a new patient, treating all your patients as a new patient, especially when you have that plentiful information in your paper charts or your legacy systems. A lot of these we've touched on. I think one other thing I want to talk about here before we move on is have a straightforward documentation tool to log and resolve issues. Now, for instance, if you are a practice that's affiliated with a larger hospital and they have an issue tracker or some sort of tool, make sure you understand, your staff understand how that tool works. You make sure your staff understands the service level agreements that your providers have with that hospital or with the vendors, so that you can have a consistent way of tracking your issues and documenting the issues. It's no use if you identify an issue and you don't document it or you don't escalate it, and you just repeat that issue, or you find that issue 3 days down the line and it hasn't been resolved. It's best to document, report, and follow through, maybe with a weekly status check, a bi-weekly, whatever the case might be, whatever the procedure. Make sure you have a strategy in place to deal with issues or problems that you're having with the system. Might be workflow oriented, might be technical oriented, but make sure there is something in place to tackle these. With that, that's a short overview of electronic medical record implementations. Hopefully this was of benefit. If you have other questions, please feel free to reach out to me at nabil@nabilrob.com. Thank you very much for making time. Look forward to having you in further presentations. Take care.